Good day, and thank you for joining Bruce County Public Library for this live presentation. My name is Nancy Cool, and I'm the program coordinator for the library. And today we are very pleased to have Francesca Dobbyn, the executive director of United Way, Bruce Gray. She's with us to talk about the 211 service. So 211 is an easy to remember three-digit phone number providing free, confidential, multilingual access to information about the full range of community, social, health, and government services. All 211 calls are answered by certified information specialists who assess each caller's needs and link them to the best available service and programs 24 hours a day, 7 days a week. I personally have used 211 on a few occasions, and it really is a super robust source for information. So before we get started today, just a few little housekeeping items. Following our introductions, Francesca will begin her presentation. So while listening and watching, we encourage you to submit any questions or comments here in the comment section or to our web forum on the Bruce County Public Library website. And you should be able to see that link on the screen here or in the description below. So we'll address questions during and following the presentation. And you may need to grab a pen and paper and jot down any information or resources of interest to you. And if you don't get a chance to watch live today, the presentation will be recorded and posted here on the library's YouTube channel in our special guest playlist so you can refer back to it again. And if you haven't already, please remember to subscribe to our YouTube channel to keep up to date with all our live presentations. We would like to remind our audience today that if you don't have a library card, we have made it really, really easy to get one. So either visit our website and click the link for a temporary card or visit your local library branch. Membership is free and it allows access to thousands of books and videos, electronic resources like magazines, movies, learning tutorials, and much, much, much more. And following the program today, please take one small minute to fill in our evaluation. Your feedback and stories help show the value of the library in our communities. So for those of you who aren't familiar with Francesca and her work, just a little background. So Francesca is a change maker and a community connector. She has served the communities of Bruce and Gray as the executive director of the United Way for 17 years. And previously, she acted as municipal tourism director and the festival coordinator for the internationally renowned Wyerton Willie Festival. Francesca is a familiar face in our communities and is always there in her role with United Way to lend a hand. So hello and welcome.
Thank
We are
you much.
no problem. We are so happy to have you with us today, and we're looking forward to learning more about 211 and excited to help you bring some awareness around this valuable service.
Oh, that's awesome. I know growing up as a teenager and a child in Kincardine, I used to haunt the library and know it's a great way of and a great place to start learning about community and connecting as well as, all those events that we were always, the authors and all those things. So really pleased and honored to be asked to make this presentation. So I'm just going to walk through this. So 211 is a phone number at its most basic. So I'm just going to walk through kind of a macro level of how the service works and then how you can connect to services in the community, how you can help friends and family. So I'm going to try not to go too fast because it's been that kind of a day and we're a little hyped up on caffeine. And please don't hesitate to ask questions. Nancy can totally interrupt me if it's a question that relates to that slide because there's a lot of questions out there and 211 is going to be the answer to a lot of them. So 211 is part of the three-digit dialing codes as approved by CRTC. So you've heard of course, the 911 and, the 411, the directory assistance. And now, with our weather systems and our roads and Highway 21 being what Highway 21 is, 511 is really helpful for traveler information. So 2111 launched about 20 years ago. And so this has been, as the CRTC, how those lines lay out around the three-digit dialing. And for large cities, Windsor, Toronto, Calgary, they have the 311 non-emergency municipal government services. So if you're in Calgary and you miss recycling day, you can call 311 and find out, hey, what do I do with my recycling today? Or if some skunk didn't make it across the road and it's smelling up the neighborhood because a car took it out, you can call 311 about that. Whereas we don't have that in a rural context. It's way too cost prohibitive for our small municipalities. And in some ways, 211 fills that gap of information because it can connect you to those municipal services. So the really important piece around 211 is that it's accredited by AIRS, which is the Alliance of Information and Referral Systems. So this is not, just people who are volunteers. This is trained staff. It covers 20 different standards with 200 quality indicators across the 5 areas because service delivery, it's really important that people get the right information. How we keep the database up to date. So the database of information of what people are being referred to, it's really important that it has to stay up to date. You don't want to give out a phone number if the phone number's changed. Cooperative relationships. We do a lot as a United Way with our local 211 call center. You call 211 about backpacks, you call 211 about utility programs. And one of the things that's kind of came out of Bruce Gray is that disaster preparedness. So when we had the tornado in Durham back in 2008, and then the 2011 Goderich tornado, 211 was there for that community information. 911 for the emergency, 211 for the community. And then again, organizational effectiveness of how they're delivering those services and the services of 211. And so everybody that's involved has to go through this accreditation process. So the Ontario 211 network is 6 independent organizations are contracted by 211 Ontario to deliver the services. So Central, which is kind of the yellow one, is Toronto, and that's where it all started. Down around Central South, St. Catherine, Central East, which is our area, which is the green on the map. The North, East, and then down southwest around Windsor. And these are all the backbone. They look after the database that is local to those areas. So you get you can have a lot of nuance that is to that community. There is a lot of customization. So when we get into what's listed, you can have one single listing as this is the ABC church, but if that church also happens to run a moms and tots or a parents and tots program, that gets separate as a separate listing. Or if there's a sewing club, or if there's an LGBTQ group that meets, it gets listed as a separate listing so that it all comes up during those searches. And you can call, you can text, you can search online, you can email, you can chat, and you can TTY with 211. We will help you connect. So here's a few examples of why you would call 211 and what a community navigator can do in terms of providing support. So, the top left-hand corner has someone whose hydro's disconnected. They've reached out to the LEAP program, but still haven't heard back, and now they don't know what to do. They can call 211, and 211 can explain to them, one, how LEAP works, what the hours are, how busy LEAP has been, and that might be why there's a delay in a callback. Is this disconnection inside the disconnection ban, and should this be accelerated to the Ontario Energy Board as a complaint because it shouldn't have been disconnected? What's going on here, as well as what are other supports that are out there. Maybe you don't qualify for LEAP, or maybe you've already used it once this year and you need it again so desperately. So a lot of utility information. That's one of the things that the 211 Ontario crew is really up to speed on, is that utility piece. Our senior looking for dental assistant. Has trouble eating, that really impacts a person's health, what kind of shape their teeth are in, and they need to connect to dental services. And at this point, there is nothing out there. There's very limited resources for adult dental. There's some for seniors, but it's not a lot. So maybe they need to be connected to a dental school down in the southern parts of Ontario to get that work done. They need it so they can, start eating healthy again. And hey, you may just need help finding the phone number for the library because you want to check the hours or you need your vaccine passport printed and you want to know if they're still doing that. You can call 211 and say, hey, what's the number for the library in Kincardine? And they'll tell you what the number is. And it's free to call. That's the best part of it. And it's 24 hours a day, 7 days a week. Where's the nearest walking clinic? We're certainly starting to see this question on Facebook quite a bit when people are coming out of the cities and they're like, where's the nearest walking clinic? And you're like, oh, it's called the ER and it's at the hospital. Sorry, we don't have walking clinics. And that's a bit of a learning curve. And we see that with tourism as well, over at the beach and Sauble Beach, and somebody's run into a bee sting or something like that. Where's the walking clinic? Oh, sorry, you're going to have to take him to the hospital. The legal issues need to connect to legal aid, and that could be around housing. I've been served eviction notice, and I don't know what to do with that. Where's the nearest legal clinic, and how does that work? And this top one with our lady who's obviously kind of worried and stressed here as a full-time caregiver for her husband who has dementia. Some days we can manage, and other days we are done. We are done with COVID. You can call 211 and say, I am done. Where do I find help? Who can help me? And a great time to call 211 with things like this is when you get that diagnosis. You get home from that doctor's appointment and you're staring at each other going, what is going to happen next? You can call 211 and say, okay, we've just gotten this Alzheimer's diagnosis, and they'll know that there's a program called First Link, and it's for the newly diagnosed, and they will connect you to that service. So then, our family at the bottom, there's a sewer backup. They have to be out of the house because it's dangerous and we don't know what to do. Emergency housing is a big piece in the winter for 211 as well. How do we connect? What programs are out there? How does it work? How long can I expect to be housed? And who's going to pay for it if I can't pay for it? And those are all those connections and potentially those answers. And sometimes, there is no answer. There is no homeless shelter in Bruce counties, but there are programs. And how do those programs work? And our friend here in the bottom right, is having a rough go of it and just needs to talk to somebody. 211 can do a three-way call with a distress line. So you could call in the 211, again, those AIRS accredited folks who understand and can hear between the words how stressed this person is. Pull in a third caller who's got that extra special piece of training, hearing between the words, and then, it's a warm handoff, if it's even a handoff, or they stay in the call. There is no rush to get off the phone either. I've had people tell me I spent 90 minutes on the phone with 211. I have a friend who's escaping an abusive relationship, and we needed to make a plan, and we got all the resources, and there's no rush to get off the phone. So there are three core areas around the 211 system. So navigate. So that's helping people navigate the system, make decisions about what they can do, what they're qualified for, what the information is, what you can expect. So if you're going to this service, you need to bring your health card, or you just need to bring some ID, or you need to bring that utility bill. What is it that is going on that you need to bring with you for that situation? And in some cases, they can follow up. So if there's somebody at risk, they will ask, can we call you back and check on things? Let's check to see if you were able to connect with that service. And ask about, listening between the words. You'll hear me talk about that a couple of times during this presentation. So if somebody calls in July and says, okay, I need help with my utilities. And in that conversation, they say, I got two kids, because they're looking at whether they qualify for not or not. Hey, you know what? Let's sign you up for the United Way backpack program while we're at it, because you have kids, and add in extra resources that that family is just intrinsically going to need, and offer them that support instead of waiting for them to ask for that help, because sometimes that's really hard to ask. We go out and we offer that help. So the other is the data. The data itself is really important, and we'll get to those slides about what our local data looks like. But it's the listing. It's the listing of how it works, when it works. What are the hours of it? What changes, and you know who else is involved with that. And keeping that up to date is both 211's responsibility as well as the people that have that support need. Um, and offer those programs. So if something changes with my organization, we get additional resources, or we've lost a program and we can't offer it anymore. It's my responsibility to make sure 211 know that. So the other day I had a staff person, my utility staff, could not get out of their driveway because of the ice storm and couldn't come into work. And we just popped a note off to 211. If people are calling about utilities today, just advise them that the staff's not in the office, and they'll get back to them. And if you need help today and can't wait till tomorrow, call the office directly and we will look and see what we can take care of. And then the other piece to the data side is that business intelligence. So we collect a lot of data around what the call details are, demographics. There's no caller ID to it. It's a bit like Crime Stoppers like that. But we do follow-up surveys, what people are looking for, and we use that data. And we'll get to how that data works later. And all of those things report back to the community because this system belongs to our community. It is funded provincial. Well, now it's funded federally. Thank you, pandemic. Small silver lining. It is funded provincially. The two counties, both Bruce and Grey County, contribute locally, and it's funded through a large grant through the United Way as well. And it is the United Way project to some degree. So what's really important about 211 is it gives equitable access to services. So I don't know if you've seen this graph before. So everybody on the left-hand side has an equal access to a service. They each have a box that is equal in height. But you can see that what they need is different. And then on the right side of things, this was equity. So everybody gets to reach for the apple. Everybody gets the amount of service that they need for them to achieve what they need. And that's what equity is about. It's about reducing those barriers to that service or to a program. And that's where there's interconnectedness. So if transportation becomes an issue for something, we need to loop in a transportation service so somebody can access something. And we've seen that very much with the vaccine rollout. We had the 3 hockey hubs. That's great. But if you can't get to those, we're putting ones, out there in the community. Crepes, we put them on ambulances and made it totally mobile. So that's really important to how people access services as well. So this is the numbers for our database of resources. So in Bruce County, there are 274 agencies that are listed, which represents 411 sites. So if you think about, the libraries throughout Bruce County, there's one library system, but then there's 17 individual libraries. So that's the difference between the agency and the site. And then, running 464 programs. So what we would have is actual 460, for listings for all of those programs rather than just having the one, listing the 274. We list everything about it, and you can see how comprehensive that number of listings are to enable all those pieces to be out there. And some listings are time limited. Things like a vaccine clinic or things like that are time limited because it comes and it goes, and other things are here forever. So we have databases that support regional databases as well. So we have themed database. So we have the whole 211 Ontario. We have 211 Central East Ontario.ca, and then we have micro directories. So we have information Bruce Grey, which I'll show you on the next slide. We also have newcomers brucegrey.ca, which is an innovation that came out of Bruce Grey, where we can use Google Translate and translate the website into 150 or however many languages Google Translate has. It's not pretty because it's Google Translate, and it doesn't have nuance, but it has enough that if you have somebody with a language barrier but can read in their own language, you can pull that up in their home language, and you can actually flip back and forth between the English and that language. So you as a service directory person can read it, understand it, and then give it back to them in their language. It's very cool. And we're the ones who pushed 211 Ontario to have that integrated into the system because it required primary reprogramming of the overall database. The Graybridge Children's Alliance has an online directory for just children and youth, as well as We Care. We Care focuses on mental health and suicide prevention for children and youth, and the Graybridge Community Info, which is customized directories for Gray and Bruce as well. So we can create themes around specific databases. So this is kind of our baby. So this is Information Bruce Gray. And the first thing is, so informationbrucegray.ca. We've had this one here longer than we had 211 because we created the database first, which is why it's branded Information Bruce Gray. So one thing to note is there is an 800 number at the top, the 866-743-7818 number. That's the 800 line for 211. So if you have a magic drac, so an internet-based or a VoIP phone system, you cannot do the 3-digit dialing. It doesn't work very well through an internet telephone, but you can call that 866 number and you get into the 211 system, the same as if you were just dialing 211. So on this site, you click here for services and you can go and search, keyword search. It comes up with a directory of towns, so you can narrow it down to a town or leave it out to Bruce Gray. The other thing with this particular site is we have this food calendar. So every day you can go in and you can see when we took the screenshot of this one was back in February. And that's where all the free meal programs are that day. So if you happen to have somebody and you're volunteering at your local food bank and they're looking for a hot meal, you could pull this up and say, hey, there's a hot meal at such and such a place. Or if you can't remember when something's happening, you can check that meal program and how it's running to assist people in the community. And it just updates every day. So just as a reminder that this is a phone system. This is, if you got a question, you can pick up the phone and phone 211. But why? Why are people, what are they calling about? So this is the top needs. And this is Grey County data. I didn't get it updated in time for Bruce County data, so apologies that it's Grey County, but it's going to be fairly similar. So these are the red box is the top 10 reasons for calling 211. So, and you can see the change as it comes in around the pandemic. So health, kind of middle numbers, and then boom in 2021, major increases around that. For a long time, housing, you can see housing would have been much higher than health, but that changed with the pandemic. Utility assistance, again, was always kind of in the top 3. And then, of course, mental health issues around this pandemic, and the stresses, income supports, what's going on with the CERB, where do I'm hired, I'm fired, I'm hired, I'm laid off, I'm locked down, I'm out, I'm in, I don't know what's going on. Lots of that information. Seniors with the GIS loss and the clawback there, huge impact on our community. So this is where that data of why are they calling gives us a flag of what's happening in the community. It's the, canary in a coal mine. What are we needing to focus resources around? So then within those categories, what is it they're calling about? So under that health category, health education. So this could be those, what are we allowed to do around, what's the current status of lockdown, vaccine passports, all of those information pieces around health education. Somebody, people looking for expenses and assistance with medical equipment, as well as home care. And then again, emergency shelter for housing, assistance with housing expenses. So, I'm not going to read every line here, but you can see what people are calling about within those categories of what they're looking for to get connected to assist them with their lives. So this is a piece around the impact on service and how the pandemic was. So, that first wave, which is this purple line, was very much about the the seriousness of this pandemic, the loss of lives that we saw at the beginning, and how that works, that first wave and things, second wave, looking at restrictions and, you could golf, but you couldn't play in the park and all of those things. And where we are now with this, fourth wave, fifth wave is that long, exhausted, we're done with COVID. We're just done. Well, the virus is not done with us, but we have to recognize where we are at around stress, economic injury, burnout of just being done. And then the other graph here on the right-hand side is about where the resources are and what the need is. And this is where, what happens around those resources and, what's needed and what the capacity is. So when people are coming to meal programs and food banks and utility assistance programs, and the need is really high, but there isn't the funds available to meet those needs. And that's where you get that curve of essential resources and gaps in the community between what's needed and what has capacity to meet those needs. And the other side of this, of course, is what is unmet. What needs are not being met, because that's where we really need to start paying attention to the data. What's not, and this is where, our utility assistance program is 16 years old now, and it came out of starting to get more and more calls here into the office before we had 211 asking for help with utility assistance. And, when all of a sudden there's a rash of calls on a particular topic, it's like, okay, what's going on out in the community? And I will often go back to our 211 call center and say, okay, 10 people have called this week about a unique something that we've never encountered before. What are you guys seeing? What are you hearing? And these were the top 10, again, in that red box there, of the Grey County unmet needs. So they've called into the program, they've called into 211, and 211 is not able to help them. And we'll go into the whys on it on the next slide here. But these are those pieces around, what needs are not being met by the person who's making that call. And understanding the why they're unmet is really important. So, 16 calls looking for a homeless shelter. We don't have one. Looking for help, looking for housing. And it's possible that those folks, those 6 calls there in 2021, we're told, well, why housing? Well, I'm already working with them. I'm looking for another agency to help me because I need more boots on the ground trying to help me find a place to live. Well, there is no one else. We don't do duplication on that service. So, and then moving expenses assistance. There is no program out there that will help you move. So that's where those pieces come in around, and this may be around the vaccine as, I'm looking for a clinic in my hometown and I live in a tiny village somewhere. Well, there is no clinic. So that's an unmet need. And then these are the top reasons for unmet needs. The agency program resources are depleted, so there's just nothing there. There's a wait list. You're ineligible for the service. Your income's too high, or if you're a person who isn't age eligible for the vaccine when we were looking at that, or you're not in the right service area for the third dose kind of thing. The hours of the agency or the program do not meet your needs. It's a food bank that's only open during the day, and you work, so you can't meet their timelines. There's no way of getting there. Transportation is a huge issue in our community. Or, like that adult dental I talked about earlier, there's just simply no resource to meet that need. So the information in our referral system is that, we look to outcomes, the immediate connections to deal with what's going on right now. So, what, you've got a disconnection notice on that utility. Okay, we're going to take care of that. We're going to look into that. We're going to resolve that issue for you. And then we look to the long term. And that's when, okay, when you've got 20 people who suddenly can't pay their utility bills, what's going on here? Is this poverty? Is this inflation? I filled up my gas tank yesterday. That was, I still have trauma from that. $1.55. It's a good thing we're not driving anywhere anymore and we're using Zoom for everything because, if we had to drive for meetings with that cost, that's a huge impact on household. And we're seeing that with inflationary costs around food as well. And so then that goes into that fourth blue box, the systemic outcomes. This is where we look at all those things and we go out and we talk about what's happening. The cost of housing, the cost of food. So we're going to need to support our food systems because the grocery budget is the one thing we'll cut back when we have to cut something because we can't cut the rent. We can't cut the utility costs. We can't cut the gas costs. So guess we're eating less. We're going to actually make that box of Kraft dinner feed 4 people instead of just one. Another great example around public health is working with Public Health Grey Bruce on a vaccine information line. And this was an idea that came out of our local Collingwood. And Public Health went to the Collingwood Call Center Central East and said, hey, can you help us with information? And this is really kind of cool because what they did is, so in February 21, could we help with the vaccine rollouts? How would you hire for that? Where's the money? Is there any money? So they decided to use volunteers. So Pam Hillier, who's the executive director, she's a staunch Rotarian. So 9 Rotary clubs in Bruce and Grey had 19 volunteers. It wasn't a 211, phone 211 for this. It was an 800 number because we didn't want to confuse and have people from Simcoe phoning 211 and getting the Bruce Grey vaccine line. So it had to be an 800 number. They launched it, but they had the technology. They had the telephone system, they had other pieces. So they were doing double duty with the technology that we paid for. There was a project coordinator to work with all the volunteers so that, if somebody suddenly couldn't make a day, there was another way of getting them on board. And connecting also with the health unit. So all that information was totally up to date, because one day you're eligible, the next day you're not, but then maybe you are, maybe you're not. And, please define a frontline essential worker. Is that healthcare or is it the grocery store? So here's a wonderful Rotarian who's using that system. They answered 11,000 calls, which is really amazing. 1,700, almost 1,800 volunteer hours, over 100 calls a day. And that's amazing. And that's a local homegrown response to a need and an issue in our community that was local to Bruce Grey, and it was pretty cool. And the other next pretty cool thing that we're doing through our 211 system is those income tax clinics. So it's really important to get your taxes filed, all of those government rebates and things that are coming through your tax system. There's a lot of free income tax clinics out there. So we actually this year turned around and bought freetaxclinics.ca and we pointed it to a directory on 211 of all the local clinics. We know Bruce County Library is heavily involved in the Bruce County volunteer income tax clinics, but also throughout Bruce and Grey counties and also throughout Ontario. So, if you call 211 about outside the area, and you can always call 211 and say, hey, I have a friend in Kingston. Can you look up something in Kingston? Absolutely, they can look up something in Kingston and find a clinic near there. So I just wanted to put that plug in as well around the free income tax clinics. And I'm just going to let it open up to questions and answers and see if any questions have come in while we've been chatting.
Yeah, we do have a couple of questions that have come in, and I'll just pull them up here. Um, oh, this was a really good question. It says, how can we support the work that 211 does? Maybe as individuals and as organizations?
So the best way to support 211 is to tell people about 211 because the more calls, the more valuable it is to the community and the leadership. And so by telling and encouraging friends and family to use it is a great way of supporting it because it demonstrates value and it helps, feed that data of what's going on and why people are calling. And the other piece is to get out there and let people know that it's available. You can, you can invite us to come and present to a club. Makes it easier these days with Zoom to be out and about with these things. We took socks for our homelessness program, and I'm waving
Mm,
them, and we taped a 2-on-1 card to it, and we hand them out to the homeless so they know. So, and you can always make a donation to your local United Way, which will then in turn support the 2-on-1 system.
right. Perfect. Lots of great ideas there. That's fantastic. Thank you. Yeah, and I think yeah, word of mouth is like the best way. All those little anecdotal stories that you can share with people about how the services helped you or people that you know to get the word around. Somebody submitted a question. What's one of the most interesting questions that you've received?
Oh, what are some of the
Mm,
um
that might put you on the spot.
there's some fun things. I called one time just because I was being a bit silly and was trying to find an expert in coins because we were doing a fundraiser collecting pennies and we got some really odd coins and I wanted to talk to a coin expert
Mm,
around the value of those coins. So that was one of the calls that we got. That was unusual. I'm just trying to think. They hate being stumped. I will tell you that. I've had the call center staff reach out to me and say, "Okay, we've got an odd question around," and I can't even. Of course, now I'm on the spot. 3 o'clock this morning, I will. Tomorrow morning, I'll know the answer to this question and be able to tell you some of those stories. But right now, under pressure. Um, but yeah, it's a lot of some of the quirky things that are available in small town or the larger cities that are just not available in a small town. Some
mm,
cultural pieces.
mm,
I'm sure they.
mhm.
It's hard to stump them.
Oh, for sure. I feel like maybe your call staff and librarians have a lot in common that way. Librarians love a problem to solve and will go to any ends in order to get the answer.
Absolutely. Absolutely. Yeah, that's a quest. I think librarians and 211 staff are definitely quest motivated.
Cut from the same cloth there. Yeah, I was really one of the part of the presentation that I really liked and was interested in hearing about was how you use and kind of typify the calls that come in order to identify gaps maybe in our communities or services in our communities and that sort of thing. I thought that was very, very interesting, and what a great way to identify that, really.
And it's fascinating to watch, having been in the call center over in Collingwood and watched staff answer a call. And it's not kind of like that, it towering over intrinsic, standing watching somebody
Mm,
work. I've been out there talking when we're chatting, they answer a call and we go back to the conversation. But they have kind of like a survey monkey survey that they just go through right afterwards, to log
mm,
what was the call about. And it's like click, 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 click,
mhm,
click.
mhm,
Um, as well as then that follow up piece. So we know people can be overwhelmed. So if you go to the doctors and the doctor goes, "Oh my goodness, you're kind of unhealthy. We're worried about some heart. We'd like you to drop 20 pounds. We want you to do, here's 15 things we'd want you to do." Meanwhile, you're sitting there going, I'm homeschooling my kids. I'm trying to run a business. I'm trying to do this. There's a pandemic and, you want me to just, and
mhm,
it's just like, not happening. And when you do this with people with limited resources, the doctor, sees you 6 months later, you haven't done any of the 15 things that I asked you to do. Well, no, because my life is crazy. Whereas what we can do with the 211 piece, and we're working on some of these things, is 211 would get a hold of, you would call 211 and my doctor says, I need to get healthy. How do I do this? And it's like, okay, so, gym membership might be out of the question, but, there's a free walking club down at the rec center that's paid for, by municipal taxes, and you can join that. And then while you're at it, oh, okay, so you don't have transportation, so let's link you up with a transportation system. And it's really quite fascinating when people bring issues to the table and people brainstorm and go, okay, how do we solve this? um, and that's what's happening. So we are working on some projects where the doctors can send the referral to 211, and
Mhm,
then 211 figures out what social agencies can help that person, and then they go back to the person themselves and said, okay, we need to set you up an appointment with some physiotherapy, or we want you to go out to the senior center because they're going to have some activities in the afternoon, and they do a yoga class, a seated yoga class. There's a senior center without walls to be connected to, and it just wraps around that person in a more holistic, full way.
mhm. I feel that must be very rewarding when you're able to take somebody's very kind of nebulous problem and provide some concrete solutions that they can actually use and implement.
And there's some really big pieces to that as well. All the 211 staff across Ontario have been trained in interventions with sex trafficking, and they have some rescue. So it's a difficult conversation to recognize this is happening. It is happening in a rural community. And if you call, if somebody calls into 211, and again, listening between the words, and they hear, and they begin to understand and worry that that person is being trafficked either sexually, economically, they have the language and the resources to interfere and get and rescue that person. And 211 has quite a few rescues
Mhm,
so far since that program launched. There's a lot around the domestic violence, around human trafficking that
mhm,
211, can manage in a way that augments and works with the 911 emergency system as well.
mhm. That's fantastic. And yeah, like kudos to your staff for the training and everything that they go through and able to handle those very difficult phone calls that they take. Um, yeah, and I also just wanted to quickly say thank you for highlighting the tax clinics because those are just starting up in our library branches. They'll run through March and April. So currently, the Bruce County Public Library is running them in Kincardine, Walkerton, Chesley, and Port Elgin. So if anybody is interested, you can call those library branches, and you can find the number on 211. And book an appointment for those. So, yeah, it's always a busy time of the year running those clinics, but they're very well received and well used in our communities. Yeah, and then one other thing I wanted to highlight too was you kind of touched on in your presentation about how some of the information is curated for Gray and Bruce, starting with that information Bruce Gray website. So there is a direct button on our County of Bruce website to 211 information specifically for County of Bruce. So that's on there. If you just go to the County of Bruce website, it's right on the main page. It's an easy link.
There's lots of ways to get to
Yeah.
211. And if you
Hmm.
forget any of this, you can pick up the phone and ask 211, and they'll tell you.
Exactly. Exactly. And that's the best part. All you do is call. All right. Well, I think that is it for our questions for today. So I think we'll just wrap it up. Francesca, did you have anything else to add?
Not at this time. I'm just thrilled. Thank you so much for having us.
Great, no problem. So for more information, again, just please consider visiting the website, informationbrucegray.ca, and then for newcomers in our communities, the newcomers brucegray.ca website as well. Some fantastic information on there for people new in our communities. Thank you to our staff here at the library, our digital services coordinator, and for our communications coordinator for making all the magic happen on screen. Um, and one last reminder to arrange for your library card today with your local Bruce County Public Library branch and to share your thoughts about this program by filling in the survey. And lastly, to subscribe to our YouTube channel where you can find more live and recorded presentations. We have stories for children and activities you can do from home. Our next live presentation is on March 25th at 2 p.m. When one of our staff, Elizabeth Dyer, will share her travel adventures to Portugal since some of us are starting to travel a little bit now, but it might just like scratch the little itch until you can get out in the world again. So we're looking forward to enjoying that. So thank you again to Francesca and to you for tuning in today, and everyone have a wonderful